Good afternoon to all of you, and thank you again so much. It's going to mean a great deal to a great many people. The date before the original date for this meeting, the world changed for us all. Those stark moments of September the 11th, the farewell messages of love, together with the heroism of so many, set new yet old priorities. Personal bonds, sheer hard work, and a new sense of community made other matters seem unimportant. But life and dying goes on, and the work you recognize with this wonderful award has perhaps a new relevance for us all. So with an especial regard for this city, it gives me immense pleasure to acknowledge this award, so welcome and with such potential for new possibilities in the hospice and palliative care movement throughout the world. The movement, out of which has developed the specialty of palliative medicine, grew from many previously unrelated elements, but can be pinpointed to one person, whose photograph you have already seen on the video presentation. David Cashmer, a Jew previously from the Warsaw Ghetto, died in that London hospital early in 1948, leaving me £500 to be a window in your home. And the simple but profound request, I want what is in your mind and in your heart. That plea has been echoed by many millions around the world, but is now being addressed by all those working in this field, and it is they who are the true recipients of this marvelous prize. One such person is Dr. Gustavo De Simoni, who had trained as an oncologist in Buenos Aires and who in 1983 went south to carry out his national service in Patagonia. There he met a former patient who was now suffering from persistent malignant disease. Dr. Simoni was aware that he had no idea how to help his patient in this later stage. Fortunately, however, he met a traveling book salesman who happened to have with him a copy of the first textbook published from St. Christopher's Hospice in 1978, which had subsequently been translated into Spanish. It gave him, he later told me, all he needed to support his patient and their family through the remaining months of his life. Now a professor of oncology and palliative medicine, Dr. Simoni leads the hospice and palliative care movement that continues to develop in Argentina. That textbook was written and designed to present the main principles of hospice and palliative care. It included detailed principles of approaches to pain and symptom control, home care management, and a discussion which was entitled Appropriate Treatment, Appropriate Death. It looked at the whole philosophy of support for patients and families at the end of life and included chapters on law, ethical, and spiritual concerns. As editor of the textbook, I was greatly heartened to hear of its overall relevance to someone who was working in Patagonia. Such stories continue to reach us from around the world. End-of-life care was completely disregarded at the inception of our United Kingdom National Health Service in 1948. Its lack in the United States was also illustrated vividly in the stories of 200 dying patients detailed by 4 social workers in Boston and published in the New England Journal of Medicine in 1945, a triumph for social workers. This was further recognized by the psychologist Herman Feifel in his seminal book, The Meaning of Death, published in 1959 in the United States, with many compelling chapters, including one by Carl Jung on the soul and death. But it had little or nothing, however, on symptom control from the physicians, who concentrated on discussions of whether and what to tell their patients and how to ease the very last moments. At around the same time, I was asked by the dynamic author of the London Nursing Times for a series of articles on the care of the dying. They were printed in a booklet, and that became my introduction to pain researchers, psychologists, nurses, and the 18 hospitals and homes I visited on an 8-week tour of the United States in 1963. It was the beginning of the whole hospice movement, as yet unnamed, and the catalyst for many wonderfully fruitful personal and professional links. Following on from these meetings and my time with many patients, in 1964, I first wrote the definition of what I called total pain, with its physical, psychological, social, and spiritual elements. And in 1967, St. Christopher's Hospice, as we have heard, opened in London as the first modern research and teaching hospice in order to tackle this widespread problem. St. Christopher's brought together plans for inpatient and home care, family and bereavement support, research and teaching, all to be integrated into the local community services. The basic principles being demonstrated there were planned to be fed back into the work of our National Health Service and to be shared and spread as widely as possible. It was not planned as the model, but rather as an example of how skill commitment could improve provision for the end-of-life care with no backup beds, began much later in this country. In New Haven, 1974, at the same time, a consulting team began in the wards of St. Luke's Hospital, New York. In 1975, the word palliative was adopted for a unit backing a consulting team in the Royal Victoria Hospital, Montreal, led by Professor Balfour Mount, who, like the leader of all these teams, spent a period of sabbatical at St. Christopher's Hospice. So the different patterns were then established, not one model, but many ways of doing the same basic care. Since then, the movement has spread throughout the world. Mind and heart, as requested by the dying young Jew David Cashmer, was said as part of a personal exchange, but on reflection led to the combination of science with unconditional personal regard, the sociologist's word for love. Whether in African or Indian villages, and over 60% of our links are with developing countries, or in the most sophisticated hospital, people need the skilled nursing care and expertise that will improve symptom control, matched with concern for them as individuals. Those battling with the devastation of HIV and AIDS in such places as Africa, on this World AIDS Day, as my prayer diary from St. Christopher's tells me, need all the resources and more. And we have seen in the video some of the work of the hospice team in Uganda. Here, I must salute the work of the United Nations under the leadership of Kofi Annan in bringing... And he has been working in bringing the needs of the most vulnerable to those who have the power to change things. Much has been done, but there is still much to do, and we must all take a responsibility for enabling change to take place. We can learn how, in spite of poverty, we can still help families to give care. In a South Indian village, the palliative care team is supported in its help to the 400 incurable people of that area by 1,000 farmers and shopkeepers who each give 1 rupee a day to their funds. What they do, with the aid of their headquarters in Calicut, which has 22 separate bases around Kellara, is comparable with the more than 2,000 or even more than that hospice teams around the US. And as it happens, we have an enthusiastic doctor from that group on a course at St. Christopher's at the moment. We have so much to learn from developing countries, and it is so good when they come to share with us what they're managing to do, literally on a shoestring. We know we are partners in a worldwide network. Requests come in daily to our information service, and we are in touch with efforts in Ghana at present, where there seem to be exciting possibilities on the horizon. The personal and family values that have made this multifaceted development possible are of the essence of our common humanity, dating back to the early men who laid down their dead in grief with a few precious tools beside them. We in the West have still much to learn, but it does go back a very long way. Many cultures try to encourage hope for recovery to the end, and physicians find great difficulty in making a prognosis of inevitable death. Yet many people want and need to prepare and to say farewell. There are other hopes beyond the hope for recovery. We did not need the evidence of the United States support study, widely recognized by the medical establishment here, to reveal the poor communication and end-of-life care on many thousands of patients in general hospitals. It showed in stark statistics how difficult it is to give up, let go, or whatever pejorative term is used. But it has stimulated a great and much-needed program of research and education now underway. I think we have all been in this place, whether professionally or personally. Am I going to die? Said a patient to me in 1960, after many weeks in St. Joseph's Hospice, where I first worked on developing pain management. When I said simply yes, because to prevaricate would have been an insult to his enduring courage and realism, he asked, "Was it hard for you to tell me that?" I replied, "Well, yes, it was." He said, "Thank you. It is hard to be told, but it is hard to tell too." It should be hard. We are committing both of us to a journey, one of acceptance and growth, the other of continuing care or the assurance of help from a skilled team. That particular journey was one I shared. It gave me the authenticity of personal loss and a determination to continue to work to improve care as widely as I could. Not alone. No one should fail to build a team to share these challenging demands, but in company with all those who share this wonderfully imaginative and generous prize. So what is relevant to us today? Is it the way that hospice care and the specialty of palliative medicine that has grown out of it has disproved the myths concerning morphine and other strong painkillers? Is it that it has shown that such drugs can be used effectively for months without inducing drug-dependent behavior, nor the need to keep increasing doses until the effect is lost? Or is it the salute to our common humanity, so widely expressed in hospice care? And is it how this is celebrated in the way appropriate support can enable people to make good conclusions to their lives with reconciliations and a brave individuality worthy of all that has gone before? Today's secular world still searches for meaning, for a belonging beyond themselves, while asking for competent compassion, mind matched with heart, the openness of the window, and a freedom of the spirit. David Cashmer, who gave a voice to these concerns, finally found peace with the God of his fathers. It is a heritage that has led us to the reception of this wonderful prize, readying us for still more innovations firmly linked to those basic principles. We may be small specks of dust in the immensity of the galaxies, but yet everyone matters. The hospice welcome to each person, patient, family, staff, or volunteer, is simply, you matter because you are you, and to the end of your life. Thank you for recognizing that, together with it spread around the world, that you have recognized it here today. Thank you.